Good afternoon, everybody. Welcome to April Office Hours. Appreciate your time today. Thought we'd get started and get right into it. So today we're going to get into our normal activity, and I just want folks to know we're recording as usual, and we'll have it on our website in the coming days. If folks have questions along the way, as always, please stop and unmute yourselves or put stuff in chat, and we'd be happy to answer along the way. Can folks hear me okay?
Yes.
Yes.
All right, great.
Yep.
And we can all see the slide deck, I'm hoping.
Yep.
All right, perfect. All right, so we're gonna get on to policy and procedure updates. We're gonna go over some children's stuff, a little bit of NetSmart, talk about the trusted CES tool, and anything else that anybody would like to talk about today. So it's not a real robust agenda, but we've had some pretty heavy agendas in the past month, so that should open up if anybody had anything else they wanted to talk about today. So we're going to move forward, and I'll turn it over to Jessica. Jess?
Hello. Today we're just gonna go over an annual update for Health Home Plus policy for HIV and AIDS. And then we have some upcoming policies that we are working on. We have the Children's HCBS waiver policy that's going through some minor changes, continuity of care, which will be a annual review. Eligibility and appropriateness criteria, which we get updates weekly from DOH on changes, so that's in the process. Plus, we're going to have a new process for the HCBS youth in waiver for requesting environmental modifications, vehicle modifications, and adaptive assistive equipment. And then we will be having an annual update to our palliative care and bereavement policy. So those should be coming out in the next month or so. Go to the next slide. So our Health Home Plus policy for HIV and AIDS, this was an annual review. There were no updates to the actual policy noted, but I did just want to put a reminder out there that all of our policies moving forward will have reference to the actual DOH policy. The policy was pulled from standards or guidance that was issued by DOH, and you can find that at the top of the policy. Under date revised, it'll note either if it was a DOH policy, the health home standard, or guidance issued. And then I have also been linking back to the state website if there's something to link it to. Does anyone have any questions? All right. Children's program updates. I just wanted to let everybody know that there will be an interdisciplinary team meeting form that will be built in NetSmart in our production environment. Right now it's in UAT. It has been approved. We have asked NetSmart to push it to production. It hasn't as of yet, but it will be. So you can find that in the bottom left-hand corner of your NetSmart screen under additional forms. We will notify the network once it is in production, and we ask that you start using this form to record your interdisciplinary team meetings moving forward. Right now it's not required, but we will be updating our plan of care policy for children to make that form required, just so everybody is recording those all in the same place for ease of auditing by New York State. And then the other thing I just wanted to send a reminder out about is K codes and level of cares for youth who are enrolled in HCBS waiver. Please make sure that you are completing the level of care supervisory sign-off forms that allows the care manager to complete the required documents, have their supervisor review the documents, send it to me to have the health home review and sign off, and then you can complete the level of care. If you do not follow that process, you are at risk of completing an ineligible level of care, meaning that you don't have all the documents in place. And we are audited annually on that, and we are coming up on our annual audit. And then for our annual, well, not annual, but we're due this year for redesignation, they will be incorporating our HCBS scores into redesignation. So it's super important that we are following policy and procedure on that. And then just reminding everybody that if you have an HCBS level of care due, it has to be due on the date that the previous level of care was completed or before the previous level of care was completed. If you do not complete it to the date, there is DOH policy that you will not be able to bill for health home care management services for that month if your level of care is overdue. So it's extremely important that we start getting this documentation ahead of time, making sure it's all correct, having your supervisor review it, having the health home review it, then completing the level of care, and having it all completed on time. Does anybody have any questions on that? Okay, the next slide is just a screenshot of what will be put into production for our interdisciplinary team meeting form. It's a super simple form. It's just a place where we can record the information all in one location. So we get credit on audits that are completed for HCBS and audits that are completed of our children's program by DOH. So you'll be able to, obviously, you're always going to want to put everything in final. It doesn't count unless it's finalized. Who is hosting the meeting? That would always be the health home care manager, the date, the member's name, member's date of birth. You're going to click whatever you're meeting about. Then you're going to be able to add the participants into that meeting. You will be able to add more than one participant. It's just showing one line here. You'll be able to add more than one. Then basically the plan is just a free text box. It would be the same if you were writing a note. And then on the bottom, we just have yes, no, and NA for that feedback form. That form was not built electronically, so that's still a form that you're going to want to potentially send out to invite people to your team meetings and also solicit feedback from providers who will not be attending those meetings. Does anybody have any questions on this? All right, well, if you do, please let us know and I will email the network as soon as it is put into production. Could NetSmart update the eligibility assessment CAN score to show current terminology? So Trisha is asking in the chat that if our eligibility assessment will be updated to show current CAN's terminology. So NetSmart is working on updating the children's billing questionnaire with updated terminology, but that is on hold because there are some changes that will be there are changes that are forthcoming to the back end logic of our CVQ. They have not been finalized in state policy yet. So instead of updating everything to current terminology, it's on hold until we get updated guidance from DOH on some of the changes that are coming with the requirements to billing for children. So they are looking at the CAN scoring, then they're also looking at the requirements for billing, and we will be looking at potential updates to that. So they are holding on any changes until that is finalized and then changing it all at once. Does anybody have any questions on that? I'm not sure what I could actually answer on the changes from DOH. We were presented with something and sent quite a bit of feedback, and I haven't heard much since then.
It's in a black hole right now, basically.
It really is. They really took something that was pretty simple and made it extremely complicated while trying to support us, but it overcomplicated something. So there was a lot of feedback sent on it. All right, well, I will share more on that when I know more. And everything will be updated in NetSmart as we get more information. But if anyone has any questions at any time, feel free to reach out.
Thank you, Jessica.
Mhm.
Okay, we just wanted to put a reminder again. I know we've had this in here a couple times, but just on the forefront about social support update for our NetSmart as we're going into the records. You know, Planet Care upload is a prominent thing now. We want to make sure as folks are going in that we're making sure social support contacts are updated. You know, noting that children must have a social support contact. Adults are not required to have one, but if you do have one, we got to make sure that the address and phone numbers are entered for each active contact. And that would be the case for children for each contact to have one, to have that address and phone number. If the entity is not willing to share, we want to have the agency put their address in place of that address. And if a phone number is not able to be shared, we're asking at this point to put in ones in the place of what the digits would be, and that is able to be accepted to be passed through for MAP to accept at this point. So that has been able to be accepted as we've been doing the uploads. So if we could keep doing that as we're doing entries, and then as you can get things that valid and accurate, we're asking that that can happen as much as possible, knowing that that's not a perfect science, but as much as possible, we greatly appreciate that. And then demographics page, you know, just remember as you're going in that there's some required areas now. Primary language, gender identity, preferred pronouns, and date of birth are now required fields as you're going in. So when you're going in to update in a person's record, please make sure that you're updating those areas. Sharon's got required preferred pronouns is missing in NetSmart. I believe it's been reported and hopefully they'll fix it soon. Thank you, Sharon. I didn't realize that was an issue. Taylor?
Yes, it has been reported to NetSmart.
Okay, thank you. I didn't realize that was, thank you. Thanks, Sharon, for pointing it out. Thank you, Taylor, for pointing out that it's been reported. So make sure that that's been taken care of. So yes, so thanks for making sure that was brought up, Sharon, and we're going in and we'll get those things identified as we're going. And if you guys have finding issues, make sure you're letting us know, like Sharon did, so that we can get that stuff attended to. But these things are areas that we want to make sure that we're getting taken care of, because they are going to get kicked back if they're not filled in as we're going through for those uploads as we're moving forward. And the next area is history and risk factors. Just a reminder when you're doing those Planet Care updates, there's some examples. We went over this a couple months back. I just threw this back in here just as a reminder. You know, we gave in a couple examples here for one for an adult, one for a child, of what you could put in for history and risk factor. You know, as you're filling out for a person for Planet Care. For an adult, we put an example of being a member has a history of homelessness and chronic conditions. They're seeking support with housing and treatment adherence. An example for a child could be the members referred to health home via SPOA. They have SED and family seeking additional supports to be placed to help support the member. The member has been hospitalized twice in the past 12 months and has suicidal ideations. So just things to really clarify what is supporting that person and what are the risk factors that are supporting health home services. So things to keep in mind as we're putting those Planet Cares together. And we're asking that those are done within that 60-day required time frame as we're enrolling members into the program. So as we do those Planet Care uploads to MAP, those elements are being taken care of and we're meeting compliance so that those plans don't get kicked back. So we just wanted to pause and just see if there's any challenges, questions, you know, if there's issues like Sharon pointed out that are coming up, so that we can make sure that we're addressing them along the way. So I just pause quick to see if there's anything anybody has said. Okay, I wanted to have also a big thank you. I know Courtney and Taylor and some others have reached out over the last month and a half on some big push on these areas. And I know a lot of you have gone back in and done a lot of updates so that we could get those plan of cares to be able to be accepted by MAP. So thank you very much. I know it was a pain in the ass and it wasn't ideal, but we do greatly appreciate it. So thank you for those efforts, and we greatly appreciate it. Sus tool. Everybody knows this is another thing that everybody's enjoying greatly. And it's a requirement that's going in place, and it's another billing block that the state has put forward. 531 is when that becomes a thing. We want to reiterate what we've been talking about over the last couple months, that anybody that started as of November when the tool went into place, we have to start looking at as the month of enrollment moving forward, that we have to start to make sure that assess tool was completed. So we have to look at that time frame so that we don't have people having issues with assess tools not being completed. So we have to November through May have assess tools submitted in order to have MAP have a report upload before the end of May, or they're not going to be able to be billed for. So we're asking that folks go back and take a look at that. And we have a couple tools that we put in place that we've spoken about, and Taylor's going to be touching on that in the next couple slides. So we want to take a moment to do that again and just talk through that with folks, because I know there's been some questions on that. So I was going to kick that over to Taylor to talk about and afford the opportunity for folks to ask some questions. So Taylor, I'm going to kick it over to you.
Thank you. Yeah, I got quite a few emails expressing some confusion around the report in DataDen. So I just wanted to take this time while we're all on together to just quickly talk about it. So this is the initial CES due by month. That's the name of it in DataDen for you guys to take a look at. This is only showing members that have been enrolled for 12 months or more and don't have their CES tool completed already. It's going to show you the consent date. So again, like Travis stated in the past slide, we're looking at the consent date, and that's what we're going off of to know when the member is due for their CES tool. And when they're going to be due for their CES tool is going to be in the column that says CES month due. So I had a few questions that folks thought that every CES tool or every member that was on their list when they clicked on this report was due by the end of May. That's not the case. All of the ones from months November to the end of May are going to be due by the end of May. So you want to go back and do them for November, December, January, February, March. You'll do your April ones this month. You'll do your May ones next month. And then you'll be all set and caught up for the billing block. The ones that are due like in June, July, August, you guys don't need to do those. If it says the CES month due is June, July, August, September, whatever, you're not gonna do those until that month comes up. So only the ones from November till May are gonna be the ones that'll have that billing block go into effect if they're not done. And then moving forward, as the months go on, when June hits, you'll do the ones that say June in that CES month due column, July, and so forth. So I hope that's a little more clear to folks with that explanation, but if anybody has any questions, feel free to shout out or pop them in the chat, and I'm more than happy to answer them.
Is that helpful for folks, or is it still unclear? Or we're trying to do our best to help provide tools to make this easier. So I'm not sure if it's doing that or if there's something we can do different, but we want to help.
Hi, Travis. This is Mary. Could you speak a little bit about when somebody's an HH plus step down? the CES tool regarding the CES tool is due. So if they're HH plus and they go into HH plus step down, let's say this month, 4/24, it's our understanding that the CES tool is due 12 months from the first month they went into HH plus step down. Is that correct?
That's correct.
Okay, so then in our programs, you're gonna show them initially as HH plus, then there's gonna be an HH plus step down,
They're only in step.
but they're only in step down in the HH plus program for 6 months, not 12 months. That's right, that's my understanding. They're in an HH plus step down program for 6 months.
Yep,
the-
that's
but the
correct.
se- Okay, so then we have somebody whose sub-program is no longer showing because that 6 months is up. So the 6 months, using my example, would be done October of 24, but we wouldn't be due for the CES tool until April of 25. So we're gonna have that 6 months where they're not showing up in the HH plus sub-program. And the report picks them up, right?
Yeah, so I mean, this report specifically is just for the initial CES tool. So this one will have no correlation to anything to do with the programs, other than this is just letting you know when they're due. We are working on more, the more weedy logic-based reports that's gonna pull in all that information based on their Health Home Plus or their Health Home Plus step down. We don't have that ready yet, but it is in the works for you guys because we know that, it is difficult to keep track of all these moving targets. I think right now folks are just tracking on an Excel. But we do hope to have a report that will capture that for you moving forward.
Thank you.
I don't know if that answers your question, Mary, but this one's just strictly for the initial tool. So anybody that's had one done in the past will not be on here.
All right, so Jolene had a question. Oh, it says you answered my question. All right. All right. Was that helpful, Mary, or no?
Yes, it was. Thank you.
Okay. And it looks like Jolene said her question was answered. All right.
Yeah, when you said this is just the initial people that
Yes.
that
Okay.
means that there's nothing on here for.
Yeah.
Yeah, and there is another report. Again, it doesn't have any logic built into it, but it will show you, it's called CES submission. So if you guys look at that report, you'll be able to see the dates, the date that your CES tool was finalized. You can feel free to export that and manipulate it however you like in Excel, to, kind of add in some logic on your end with formulas or manually or however you want to track it in the meantime. But that will give you a report of all the CES tools that have been completed at your agency, so you can track them that way.
And if someone's current status is excluded setting and they're due, or we're waiting until they're out of excluded setting?
Yes.
Okay.
Jessica, this is where it gets weedy with DOH. So yes.
Yeah, yeah,
Yeah.
I'll jump in
Yeah.
here. Yeah, so for right now, if they are in excluded setting, do not do the tool until they come out of that setting. If they come out of that setting and come back to you. We are currently working on an updated policy. However, we get continuous updates from DOH that change how they want diligent search and then the excluded setting population handled. But for right now, yep, you're just gonna wait until they come out of that setting. And then we would take a look at those dates and then determine when to complete the CES tool. Also for May, 1 is coming up. Anyone who completed a CES tool in November and got continued enrollment, your 6 months will be up in May. So that's when you're going to start to do your second round of CES tools. Because we don't have that report built yet, and if you don't want to extract those dates out of Data Den and do the manual manipulation and add in your own formulas, I will be sending out a list for everyone in May who is due for their initial and will be due for their 6 months. There's a question regarding diligent search. If the member is in diligent search, do not complete the CES tool until they come out of diligent search. If they are due, if they're not due, just continue to follow the original timeline.
Any other questions? Thought process is you can't find them. One is they're in excluded setting, so they're pended. The other one is that you can't find them, so how can you do the assessment? So, all right. Any other questions on CES tool? The tool that everyone loves. So exciting.
Can you start putting like Xanax through the speakers or something for everyone listening? Like, just
I
a
love
Xanax
that,
test.
Lori.
What's that?
So I love that idea. That's incredible. If you have one-off issues, like you have someone that's in diligent search or excluded setting, or you literally don't know what to do, just email us and we'll look at it and we'll come up with a determination. It is very confusing, and almost on a weekly basis, we get updated guidance on how they want us to do these.
Yeah, and there's also been questions that we've brought to the state and other health homes as well that has changed the Q&A document that they've put out. So, I mean, they've changed their thought process a few times, meaning DOH, which has led to policy change. So it's still morphine. That's why we've had to change our policy a couple times because of state changing theirs. So hence the comprehensive assessment date to the enrollment date change. All right, if there's nothing else on the CES tool, we'll move on. That's all we had for today. Any other topics anybody had? People excited about the budget? 125 million going back in? I am. I think it's awesome. Thank you for everybody in our network who advocated, because I know a number of you did. There was over 5,000 letters of support across the state that went back to the legislature. There was a number of hospital systems, a number from our region, actually, especially legislators, letters of support that went forward back to the state from our region that helped to lend our voice back to the government so that we could get this thing pushed back. So it was really cool to see that it went back in, and yes, we still have that 30/70 from last year that is being contended with, and there's not a lot of transparency on, you know, how that's being looked at, and the CES tool is supposed to be a big answer to that. And the state's not being real transparent on what are those numbers looking at like as far as the cost savings so far. But the Health Home Coalition and the New York State Care Management Association are advocating strongly. Their boards of directors are meeting with the Department of Health and OMH, and they're really advocating strongly for transparency from those organizations and really trying to look at data and trying to understand where's the cost savings from that budget from the last year that was passed, and you know, let's see the results. So we're hoping to hear some more on those ends. But a huge win with this budget cycle, and just a big thank you for all of you that advocated strongly, because I know a number of you did. So I'm really excited about it. It's a big win. Anything anybody wanted to talk about otherwise? All the snow melted up north?
Yes, but
Oh.
we're supposed to get more.
Seriously?
Yeah.
Hopefully it's not gonna say.
Everyone run outside and enjoy the sunshine for a moment because I think it's all we're gonna see this week.
I know. Well, if there is snow, it won't stay long. I think we made it through. Knock on wood, I think we're here, so. But yes, Lori, let everybody run outside. Get out there and enjoy the sun. Thank you for all that you do. I appreciate everything, and we'll catch up with you all again soon. And for those of you that are going to go to the Care Management Conference next week in Lake Placid, we hope to see some of you there. And we'll talk with you soon. Take care, everyone.
Take care. Thank you.
Thank you.